The best candidates for a facelift, which is a restorative procedure, are people who are simply looking to roll back the hands of time and look more like their younger self. The differences between one type of facelift and the next is simply about how extensively we lift that underlying tissue or how extensive the skin incision is based on where a patient has the most laxity. So some patients think they need a full facelift, but they only need a neck lift, and other patients think they need a neck lift, but they need a full facelift. So it's my job to tell the patients what they need in order to get an optimal outcome, but also to give them the option of a lesser procedure if it's appropriate for them. The important thing in order to minimize scarring in a facelift is not to rely on the skin to give the lift, but rather lift the face with the underlying tissue, and then the skin is just gently placed where it needs to be after that lift is achieved. When looking for a surgeon to perform a facelift, obviously it's important that you have somebody who is trained and has experience in doing these procedures. And most importantly, I think you should agree with the surgeon's overall aesthetic. And the way to do that is to look at before and after photos of patients that he or she has treated and make sure you like their results. While typically patients looking for a facelift are in their 60s or 70s, the age range is less relevant than the actual physical changes. There are some 70-year-old patients that I recommend non-surgical tightening treatments to, and some 50-year-old patients that I recommend a facelift to. So it really depends on what their specific problems are. So that's why I would advise any patients who's concerned with those areas, come in for a consultation. We'll figure it out together.